Did you know that around 10,000 people are turning 65 every day and becoming eligible for Medicare? That's a staggering number. Picture this, a sea of people, each day, all stepping onto the same Medicare boat. But do they truly understand what they're stepping into? Medicare, a word often thrown around, yet its meaning, its significance, its intricacies, remain a mystery to many. This is not a mere health insurance program, it's a lifeline, a safety net for millions of seniors across the nation. But like any lifeline, it's only as strong as your understanding of it. Just as you wouldn't step into a boat without knowing how to navigate, you should not step into Medicare without understanding its landscape. So, with such a massive influx, understanding Medicare becomes not just important but essential. Stay tuned as we unravel the shocking truth about Medicare, a truth that could make all the difference in your golden years. Now you may be wondering, what exactly is Medicare? Well, let's dive into it. Medicare, in its simplest definition, is a federal health insurance program. But don't let the simplicity of that definition fool you. It's much more than just an insurance policy. It's a safety net, a lifeline, and for many, it's the key to maintaining their health and well-being. This program primarily serves individuals who are 65 years or older, but it also extends its coverage to younger individuals with certain disabilities or health conditions. That's right, it's not just for those of us with a few more candles on our birthday cakes. It's there for anyone who meets the criteria, ensuring that they have access to the health care they need. But where did Medicare come from? Why was it created? Well, let's hop into our time machine and travel back to the mid-20th century. It was a time of change, a time of progress. And in 1965, President Lyndon B. Johnson signed Medicare into law as part of the Social Security Act. The goal? To provide health insurance for the elderly, a group that often struggled to secure coverage. You see, Medicare was born out of necessity. It was created to address a gap in the health insurance market, to ensure that those who had worked their entire lives weren't left without coverage in their golden years. It was about fairness, about making sure that everyone had access to the care they needed, regardless of their age or health status. And that purpose holds true today. Medicare continues to provide health coverage for millions of Americans, ensuring they have access to doctors, hospitals, and other healthcare services. It's evolved over the years, of course, adapting to the changing needs of the population it serves, but its core mission remains the same. So in essence, Medicare is a lifeline for millions of Americans. It's more than just a program or an insurance policy, it's a promise, a commitment to the health and well-being of those it serves, providing them with the care they need when they need it the most. Medicare isn't just one thing, but a complex system with different parts. Each of these parts is designed to cover different aspects of your healthcare needs. Let's dive in and explore the 4 parts of Medicare: Part A, Part B, Part C, and Part D. First up, we have Medicare Part A, often referred to as hospital insurance. Now don't let the name fool you. Part A doesn't just cover hospital stays. It also includes care in skilled nursing facilities, hospice care, and some home health care services. It's like your personal defender against the high costs of hospital services. And the best part? Most people don't have to pay a monthly premium for Part A. It's like a free pass to hospital coverage city. Next on the list is Medicare Part B, also known as medical insurance. Part B covers 2 types of services: medically necessary services and preventive services. Medically necessary services are the ones you need to diagnose or treat a medical condition, while preventive services are healthcare to prevent illness or detect it at an early stage. It's like your healthcare sidekick, always there to support you when you need it. However, unlike Part A, there is a monthly premium for Part B. Let's move on to Medicare Part C, or as it's more commonly known, Medicare Advantage plans. Part C is a bit like a remix of Part A and Part B, but with some extra beats. These plans are offered by private companies that are approved by Medicare. They include all the benefits of Part A and Part B, and often throw in extras like vision, hearing, dental, and even prescription drug coverage. It's like a one-stop shop for all your healthcare needs. Last but not least, we have Medicare Part D, the prescription drug coverage. Part D plans add prescription drug coverage to original Medicare. These plans are offered by insurance companies and other private companies approved by Medicare. It's like your personal pharmacy assistant, helping you cover the costs of your necessary medications. So, to recap, Part A covers hospital services, Part B covers medical services and preventive care, Part C combines A and B and often includes extra benefits, and Part D covers prescription drugs. It's like a 4-course meal, each course serving a different aspect of your healthcare needs. But remember, Medicare isn't a one-size-fits-all solution. What works best for you depends on your specific healthcare needs and circumstances. It's essential to understand each part to make an informed decision about your healthcare coverage. Each part of Medicare serves a particular purpose, ensuring a comprehensive health coverage. So, the next time you hear someone say Medicare, you'll know it's not just one thing. It's a well-crafted system designed to provide you with a wide range of healthcare coverage. While Medicare provides crucial health coverage, it's not free. Now let's dive into the costs associated with Medicare. When we say costs, we're not just talking about the money you pay directly for medical services. We're referring to premiums, deductibles, and co-payments, which are all part of the Medicare package. Firstly, let's talk about premiums. Think of a premium as your monthly subscription fee for Medicare. It's the amount you pay each month to keep your coverage active. Now, for some people, this cost can be zero. Yes, you heard that right, zero. That's if you're enrolled in Medicare Part A, which covers hospital services, and you or your spouse paid Medicare taxes while working for at least 10 years. But if you didn't meet that requirement, or if you're enrolled in Medicare Part B, which covers doctor visits and other outpatient services, or Part D, which covers prescription drugs, you'll have a monthly premium to pay. These can vary greatly from less than $100 to several $100s per month, based on your income and the specific coverage you choose. Next up, deductibles. Now, a deductible is the amount you must pay out of pocket for your medical services before Medicare starts to cover its share. For example, in 2023, the Medicare Part B deductible is just over $200. After you've paid that amount, Medicare will start to chip in. And last but not least, we have co-payments or co-insurance. This is the portion of the cost of each service or item that you're responsible for paying. It's usually a percentage, such as 20%, of the Medicare-approved amount for the service. So, if Medicare approves $100 for a doctor's visit, you'd pay $20 out of pocket. But remember, these costs can vary greatly based on your coverage and income. For example, if you have a Medicare Advantage plan, your costs may be different. And if your income is above a certain level, you'll pay an additional amount for Part B and Part D premiums. To sum it up, while Medicare provides crucial health coverage for millions of Americans, it's not free. There are premiums, deductibles, and co-payments to consider, and these costs can vary based on your coverage and income. But don't let these numbers scare you. It's all about understanding the system and planning accordingly. That way you can navigate Medicare without any unpleasant financial surprises. So arm yourself with knowledge, plan your finances wisely, and remember, Medicare is there to help, not to hinder. It's an essential part of ensuring that you get the healthcare you need when you need it. Understanding these costs can help you navigate Medicare without any unpleasant financial surprises. So, you're turning 65 and wondering how to get on this Medicare train? Well, buckle up because we're about to embark on a journey of enlightenment. The first stop, eligibility station. To qualify for Medicare, you need to be a U.S. citizen or a permanent resident for at least 5 years. You should also be 65 or older, under 65 with certain disabilities, or any age with end-stage renal disease. Now that we've established who gets a ticket, let's discuss when to hop on board. There are 3 key periods to keep in mind. First, the initial enrollment period. This is a 7-month window that begins 3 months before you turn 65, includes the month you turn 65, and ends 3 months after you turn 65. Missed the initial enrollment period? Don't worry, there's the general enrollment period that runs from January 1st to March 31st each year. But keep in mind that late enrollment may lead to higher premiums. Finally, there's a special enrollment period for those who are covered under a group health plan based on current employment. You can sign up anytime as long as you or your spouse is working, or up to 8 months after you or your spouse's employment or the group health coverage ends, whichever happens first. So where do you buy this metaphorical ticket? There are 2 places to apply for Medicare: online at the Social Security Administration's website or in person at your local Social Security office. To apply online, simply visit the Social Security Administration's website, click on Apply for Medicare Only, and follow the prompts. If you prefer face-to-face interactions, call the Social Security office to schedule an appointment. Remember to have your necessary documents ready, like your birth certificate and proof of U.S. citizenship or legal residency. Enrolling in Medicare may seem daunting, but with the right information, it can be a smooth process. So keep your wits about you, stay informed, and you'll be enjoying the benefits of Medicare in no time. Scene script. Medicare, like any other complex system, is surrounded by myths and misconceptions. Today we're going to roll up our sleeves and dive into the murky waters of these common Medicare myths. So buckle up because we're about to do some serious myth busting. First up, let's tackle the myth that Medicare covers all health costs. Now, wouldn't that be a dream come true? But alas, reality begs to differ. Medicare does provide coverage for a broad range of health services, but it's not all-encompassing. For instance, it doesn't typically cover routine dental or vision care, hearing aids, or long-term care. So, if you're planning on getting that designer pair of glasses, or that high-end hearing aid, you might want to check your coverage first. Next on our myth-busting journey is the belief that you're automatically enrolled in Medicare when you turn 65. While this is true for some, it's not a universal rule. If you're already receiving Social Security benefits, you'll be automatically enrolled in Medicare Parts A and B. But if you're not, you'll need to enroll yourself during the initial enrollment period, which typically starts 3 months before your 65th birthday and ends 3 months after. So mark your calendars, folks. Another common myth is that Medicare is free. Now that's a fairy tale we'd all like to believe in. While Part A, which covers hospital stays, is usually premium-free if you or your spouse paid Medicare taxes while working, Part B, which covers outpatient care, and Part D, which covers prescription drugs, come with monthly premiums. And let's not forget the deductibles, co-payments, and co-insurance. So yes, while Medicare can be a lifesaver, it's certainly not free. Now let's debunk the myth that you don't need any other insurance if you have Medicare. Medicare does cover a lot, but it doesn't cover everything. Many people choose to get a Medicare supplement insurance, Medigap policy, or a Medicare Advantage plan to help pay for the costs not covered by original Medicare. So, while Medicare is a great start, it's not always the entire solution. Finally, we come to the myth that Medicare is only for the elderly. While it's true that the majority of Medicare beneficiaries are over 65, it's not exclusive to this age group. People under 65 with certain disabilities or with end-stage renal disease can also qualify for Medicare. So it's not just a senior thing. Busting these myths can help you make the most of your Medicare benefits. Remember, knowledge is power, especially when it comes to navigating the ins and outs of complex systems like Medicare. So keep asking questions, keep seeking accurate information, and most importantly, keep busting those myths. Why should you care about all this information about Medicare? You might wonder. Well, let's ponder this for a moment. Medicare, as complex as it may seem, is not just a pile of papers or a bureaucratic headache. It's much more than that. It's about securing your health, your well-being, and your peace of mind in the twilight of life. Being educated about Medicare equips you with the power to make informed decisions about your health coverage. It's like having a map when you're lost in a forest. It guides you, prevents you from making costly mistakes, and ensures you get the most out of the benefits you're entitled to. So, don't just brush off Medicare as something for the policy wonks to worry about. Take charge, empower yourself. Because in the complex maze that is health insurance, understanding Medicare is your torchlight, illuminating the path ahead. In the world of Medicare, knowledge truly is power. So, you've taken the first step towards understanding Medicare. That's a remarkable leap. But remember, this is just the beginning. Medicare, like an intriguing novel, has many chapters yet to be uncovered. It's a journey, not a sprint. As you continue to explore, you'll find that there's always more to learn. So stick with us and let's discover together. Don't forget to subscribe to our channel for more informative videos about Medicare. Together we can navigate the world of Medicare with confidence.